Welcome back, ladies and gentlemen, to Babylon Health's channel on a mission to provide affordable and accessible healthcare globally. Joining us, Darshak, the Chief Medical Officer, is going to be giving us some clerical insight into his role within the company and a lot more. So first and foremost, welcome, sir.
Great to be here talking to you.
And a pleasure getting you on. So first and foremost, back rolling a little bit, prior to your work with Babylon, you served for United Health Group and even served the Obama administration as the Director of Preventative and Population Health at the Center of Medicare and Medicaid Innovation. Through these experiences, how did you get involved with Babylon?
Well, I've always been interested in how do we improve health at scale. So I'm a pediatric cardiologist and trained in how do we take care of children with complex congenital heart defects. I love that care one-to-one with patients, helping them through probably the hardest times in their lives and that of their family. Increasingly, over time, I got interested in helping not only those individuals we saw in clinic, but how do we improve health at broader scale? That's what led me to work for the federal government, helping think of, well, how do we prevent heart attacks at scale or diabetes, working on all those projects. And then the same thing in the private sector. How do we actually use data to drive improvements at scale, first at Optum and then at United Healthcare? What I came to believe, though, is that in order to truly, really rethink healthcare, you have to build it from the ground up. And that means sort of starting from scratch. And in many ways, Babylon has done that. They've created a digital-first, entirely different way of providing comprehensive primary care. And I wanted to be part of that. And the proof in the pudding is that framework works everywhere. It works in the UK, it works in Africa, it works in parts of Asia, and now we brought it to the US, and it's been super exciting to be part of that journey.
Now, do you want to just expand a little bit on your current role with the company and kind of how you're looking to propel it kind of moving forward?
Absolutely. So I'm the global chief medical officer. And what that means is I help us design our care journeys end to end. So I'm responsible for what are our clinical procedures, how do we maintain quality? How do we seamlessly think about, well, what does the journey of somebody look like who might be at risk of diabetes, or a child who might be at risk of poor weight gain, or somebody who's going through congestive heart failure, and think through that whole journey. One of the things we know is that there's a tendency in healthcare, and particularly in technology-enabled healthcare, to focus on a tiny piece of the broader puzzle. Like, how do we just sort of handle congestive heart failure with the scale that's at home? Very few people think about that journey end to end. In other words, how do you know who's at risk? How do you take care of them digitally? When do you get them somewhere in person and then even manage them after the hospital? That's my job, is to help us do that and do that at scale.
Very nice. And kind of just talking about that technology side of it, I mean, there was recent news that Babylon was utilizing Fitbits to expand access to proactive monitoring. Do you want to talk a little bit about the future of tech and medicine here?
Sure. So when we talk about the technology in medicine, that can mean a lot of things to a lot of people. And I like to think about it this way, is that technology is all around us. I mean, all of us have access to technology in our homes now, whether it's through use of the internet, it's now through our devices that sort of track us everywhere. That's ubiquitous. The hard part is, what do you actually do with the information? In other words, data is a commodity. What is not a commodity is insight and wisdom. And that's sort of what we focus on. In other words, a Fitbit is something, again, a lot of people have had Fitbits. The question is, how do you look at that information and get it to the right place at the right time for the proper insight? That's sort of what we focus a lot on. So part of what I spend a lot of my time on, and what I think is really critical, is developing that insight, that wisdom around the information so that we know how to help our members live healthier lives.
Yeah, I appreciate those insights. Now, how does Babylon differ itself perhaps from other telehealth companies that exist out there?
Yeah. So when we think about telehealth, most of the time it's simply this, which is using video visits, but yet maintaining everything else about the broken healthcare system. So that is not the way to rethink healthcare. In other words, we know, for example, that many doctors are happy to get in front of a video visit, but they don't have the protocols or the training or the tools around them to truly manage the whole patient. So when we think about a lot of traditional telehealth and the vendors that are out there, they're really focused on taking care of coughs and colds and, maybe some kind of men's health issues, not necessarily handling serious mental illness or type 2 diabetes with hypertension, with anxiety, or handling individuals who've just been released from the hospital after having gone through a preterm pregnancy and having a baby at home who has complex health needs. So that's what we do at Babylon. It's not just the video visit part, but it's really having all the data in somebody's hand and all the infrastructure built so that making appointments is easy. We help people get testing done. We make sure that they actually can follow up very quickly, proactively have care teams built around digital first platforms that reach back out to them to improve their health. So it's really that broader view of what being a primary care digitally enabled organization is.
Now, I think you just offered some good anecdotes to my next question here, because Babylon kind of has this quote, more than just the doctor on your phone. Do you want to just maybe abbreviate to that a little bit more for us?
Yeah. Well, let's think about when's the last time somebody, you or anybody watching this really needed healthcare? What was it that they needed? And then how was that actually addressed? And I think about that a lot, because what will happen is healthcare doesn't always occur in a predictable manner. So let me give a couple examples of what this means. When you first join Babylon as a member, you'll get a complete health assessment, and then we'll even check your, do a number of different surveys or monitor you. And here's one example: is we'll make sure that we also assess for, say, a screening for anxiety or kind of behavioral health issues. If you screen positive, we get you into that kind of care right away. But it's not in isolation. You also have a primary care physician. So they actually collaborate together, because we know that when we take care of the behavioral side of your healthcare, we also then improve the medical outcomes as well. So they work hand in glove through what we call a collaborative care model. That's one example of how it's not just sort of digital healthcare where you just talk to somebody over the screen, but there's an enormous amount that's going on behind the scenes that the member doesn't even see, which is that your behavioral health care physician digitally is speaking with your primary care doc. They're screening for your needs. And then let's say you have a social need, transportation, you have food insecurity, that's being addressed as well through yet another arm. So we build that whole team around the members.
Appreciate that. And just to finish up here, I mean, what does all-in-one healthcare mean to you? And kind of how do you guys provide this? Do you want to just kind of give that ecosystem overview?
Yeah, I think about all-in-one healthcare. It, simply put, we just want healthcare to work, and we want it to be accessible and high quality. Today, many people, if you need to have a prescription filled, you call your doctor's office. They may or may not get the message. You may get it refilled that night. Maybe they'll call it into the wrong pharmacy, or you don't have the right copay in order to have it delivered to your home. Then think about it. You need to get, you've fallen down outside and you've had knee pain. You need to get that looked at. You go to the urgent care clinic. They're not talking to your primary care doctor, and then God forbid you need orthopedic surgery somewhere else. It's an incredibly fragmented and disconnected experience. At Babylon, what we want to do is bring that all together. And that's why we think accessible care that's always on and always available is the key. When you know that you have that device, and on the other side of that device is almost instantaneous access to information, whether through our chat first approach or having a virtual visit within an hour or getting that care taken right away, that immediacy is what we think really distinguishes us and allows you to pull all that together. That's what we call it. It's just healthcare that just works, because when you need it, it's always there for you.
Incredibly insightful conversation. I appreciate your time. I'm going to pass the question off to the viewers here. We'd love to know what you guys think about all this in that comment section below, and consider subscribing, because as news continues to come down the wire, of course, we're going to update you here. But stay cool, stay awesome, and as always, we'll catch you in the next one.